Hello, and thank you for joining me. My name is Karen Enriquez. I'm the Family Caregiver Support Care Coordinator for SECO Area Agency on Aging. So, everyone today is understandably concerned about the spread of the coronavirus. Because it has the potential to be far more dangerous for older adults, the SECO Area Agency on Aging has also been watching the situation carefully. The content I'm sharing today is compiled from several reputable sources and follows the Center for Disease Control recommendations. This webinar will review social distancing, quarantine, and isolation practices, and discuss coping with the stress and anxiety of social distancing. What is social distancing? It can be any number of measures that are taken to increase the physical space between people to slow the spread of the virus. By now, you've heard the guidance for protecting yourself so much that it's ingrained in your brain and daily habits. Wash your hands often and thoroughly. Keep at least 6 feet between yourself and others. Stay at home as much as possible. And wear a cloth mask if you need to be out in public. We are all aware that the COVID-19 virus is a respiratory illness and is thought to be spread from person to person through respiratory droplets from coughs and sneezes. That's why keeping at least 6 feet of space from one another is absolutely essential to prevent infection. Taking these actions will slow the infection rate and reduce the number of people who get sick at the same time. We have all heard the term flatten the curve, which basically keeps healthcare systems from getting overwhelmed and allows severely ill people from getting the specialized care they need. Although the risk of severe illness may be different for everyone, anyone can get and spread COVID-19, and everyone has a role in slowing the spread and protecting themselves, their family, and their community. Seniors and people with chronic health conditions are at a higher risk, just as they are with seasonal flu. Social distancing is especially important for high-risk people with long-term health issues, including asthma, diabetes, HIV, chronic lung disease, cancer, autoimmune diseases, and more. What is the difference between quarantine and isolation? Quarantine separates and restricts the movement of people who have been exposed to a contagious disease to see if they become sick. It lasts long enough to ensure the person has not contracted an infectious disease. The incubation period is the time it takes for symptoms to appear after a person is infected. Most estimates of incubation period for COVID-19 range from 1 to 14 days, most commonly around 5 days. Self-quarantine, as applicable to COVID-19, is staying home and away from other people as much as possible after exposure or potential exposure, and limiting movement outside of the home for about 2 weeks. Quarantine helps to limit further spread of COVID-19. Isolation, as opposed to quarantine, is what someone who is confirmed to be ill with a communicable disease has to do to separate themselves from healthy people around them. Isolation prevents the spread of infectious disease by separating people who are sick from those who are not. It lasts as long as the disease is contagious. People who are in isolation should stay home, and in the home, anyone sick should separate themselves from other family members by staying in a specific sick place, such as a bedroom, and by using a different bathroom if possible. A COVID-19 person who has symptoms and was directed to care for themselves at home cannot be released from isolation until they have not had a fever for at least 72 hours. They must show improvement in respiratory symptoms, for example, the cough or shortness of breath. It must be at least 7 days since the symptoms first appeared, And isolation is also used to keep sick people away from others in a hospital setting. Stress and anxiety are natural reactions during a traumatic event, and everyone acts differently to stressful situations such as social distancing, quarantine, or isolation. The Center for Disease Control recommends keeping an eye out for signs that could signal stress. Specifically for caregivers, people don't always know they're being affected. Look for changes in your loved ones so you can be proactive about getting help. Signs of stress can make people feel anxiety, worry, or fear related to staying and preventing exposure to others. Anxious about constantly monitoring yourself or being monitored for others for signs and symptoms. Having to take time off of work and the potential loss of income and job security. The challenges of going to stores and finding the things you need, such as groceries and personal care items. Concern about being able to effectively care for family members or care recipients. Uncertainty and frustration about how long you will need to remain in this situation. And uncertainty about the future. Anger if you think you were exposed to this disease because of someone else's negligence. Boredom and frustration because you might not be able to work or engage in your regular day-to-day activities. And an increased desire to use alcohol or drugs to cope. Stress can trigger symptoms of post-traumatic stress disorders such as anxiety, distressing memories, flashbacks, and nightmares. Symptoms of depression such as feelings of hopelessness and changes in appetite or sleeping too little or too much. And the loneliness associated with feeling cut off from the world and from loved ones. But social isolation is more than feeling lonely. With billions of people currently confined to their homes, many are asking how long will this lockdown last and what happens when we do reemerge. New models are suggesting this wave of social distancing is just the first phase, and it may last until beyond 2022. What we are experiencing now is a disruption in our usual pattern. We all hope this is temporary and not something that will become a more chronic state. But in reality, with this pandemic, we see no end in sight. So it is more traumatic. The pure fact of being confined affects the body. If you change your environment in an extreme way, it changes you. Being confined and isolated affects the human physiology as a whole. It can result in changes to sleep, changes to immune, endocrine, and neurocognitive systems, and alterations to your metabolism. Fear and uncertainty can elevate stress and anxiety, contributing to sleep problems, low appetites, and elevated blood pressure. It can lead to some alcohol abuse or the more frequent substance misuse. A huge factor in the negative psychological impact seems to be confusion about what's going on, not having clear guidelines, or getting different messages from different organizations. The damaging effects of isolation and loneliness on health are not restricted to any age or ethnic group. Any one of us can suffer the consequences. Social isolation among older adults was already a problem before the coronavirus. According to a recent National Academy of Science report, an estimated 25% of older adults are socially isolated, with more than 40% reporting loneliness. This loneliness elevates the risk of dementia, heart disease, and even premature death. Isolation and loneliness are serious problems for older adults. They become less mobile, their friends and relatives die, hearing loss and other physical limitations make it harder to communicate with others, and seniors are often reluctant to even try to make new friends. The Mortality effect of social isolation is like smoking 15 cigarettes per day. In older people, it seems to worsen any pre-existing medical conditions from cardiovascular diseases to Alzheimer's. Older adults are most at risk of complications or worse if they've contracted the coronavirus, but they're also at risk of loneliness and depression. Becoming socially isolated could diminish their mental and emotional health. Fears of the coronavirus are spreading faster than the disease itself. Because of the risks to older adults, restricted access to loved ones could leave many feeling afraid and alone or completely shut out. Millions of older adults already struggle with loneliness, isolation, and lack of regular companionship. Now, imagine them being flooded with messages that elders with underlying medical conditions are at most risk of death from in-person transmissions, or that hospitals are prioritizing the lives of young persons and those most likely to recover. These messages, coupled with social distancing, is further isolating older adults. Use practical ways to cope and relax. In this unprecedented time, no matter what your unique situation is, whether you are elderly or not, we are all vulnerable. The push for people to keep away from one another is the opposite of what humans usually do in times of crisis. We understand now isolation and staying at home is essential and must occur in order to get through this pandemic. But it is equally important we all do what we can to minimize the negative impacts. Being completely worry-free isn't realistic, but what is realistic is taking steps to get some control over your worries. There are many practical things you can do to control your worries while being socially isolated. Create as much structure and predictability as you can with the pieces of your life that you do have control over. If you've got kids at home, it's even more important to maintain a daily routine. Try to stick to a typical schedule: breakfast at breakfast time, schoolwork or structured playtime during the day, and some activity in the afternoon. Relax your body often by doing things that work for you. Take deep breaths, stretch, meditate or pray, or engage in activities you enjoy. Pace yourself between stressful activities and be sure to do something fun. Talk about your experiences and feelings with loved ones and friends if you find it helpful. Try making a photo album for grandma, playing an online game with your dad, or creating a virtual book club with your aunts and cousins. And for caregivers, your loved ones may not talk to you about their feelings. Gently ask them questions and let them know their feelings are normal. If your loved one is open to it, ask them to share stories of their past. It's very comforting for them to remember. Maintain a sense of hope and positive thinking. Consider keeping a journal and writing down the things you're grateful for or the things that are going well. Take time to renew your spirit through meditation, prayer, or helping others in need. Be patient for yourself, both now and when this strange time eventually ends. Maintaining self-awareness, establishing structures, and allowing yourself a little you time, even if it is Netflix, is crucial. Be your own advocate. Speaking out about your needs is particularly important if you are in quarantine. Since you may not be in a hospital or other facility where your basic needs are met, ensure you have what you need to feel safe, secure, and comfortable. Educate yourself. Do not be afraid to ask questions. Clearly communicate with your healthcare provider, and it may help to reduce any distress associated with the social distancing or quarantine or isolation. Ask for written information when available. If you're unable to work during this time, you may experience stress related to your job status or financial situation. Work with your employer. Provide a clear explanation of why you are away from work. And you can contact the U.S. Department of Labor toll free at 1-866-487-2365 about the Family and Medical Leave Act, which allows U.S. employees about 12 weeks of unpaid leave for serious medical conditions or to care for a family member. And request alternative bill payment arrangements if needed. Contact your utility providers, cable and internet provider, and other companies from whom you get monthly bills and explain your situation. Connecting while social distancing. Since the start of the coronavirus pandemic, public health officials around the globe have zeroed in on one action to slow the spread of the virus, and that was social distancing. And now some experts are swapping the phrase social distancing for physical distancing, which more accurately defines the entire concept. Social distancing does not mean social isolation, and even a potentially deadly virus should not force us to be alone. Now more than ever, people need to find smart ways to stay connected. Research shows that a strong social connections can lower stress, improve health outcomes, and even lead to a longer life. If more than one person is hunkering down in the same place, shared activities such as playing with children can be positive. But if a person is alone, connecting with loved ones, even if it's virtually through FaceTime, Zoom, or Skype, is essential. Reaching out to people you trust is one of the best ways to reduce anxiety, depression, loneliness, and boredom during social distancing, quarantine, and isolation. This is all uncharted territory, so it's okay if we feel differently. You will likely hear a lot of advice right now, and that's okay too. It is so important to do what feels right for you. While this time seems to be a lot of doom and gloom, it can be helpful to remember all of the things we can be grateful for and thankful for and positives that surround us. For me, it's sunshine and flowers, the ability to work from home as I shelter in place. I can use technology to keep in touch with my family and friends. I even love fresh laundry so much more because I have abundant time to get it done. I am even thankful for my husband's quirky habits and his tolerance for mine. The point is, focus on the little things that brighten your day and bring you joy. Positivity and a healthy mindset can help you get through all of this. And remember, when it's over, all that will really matter is how we treated each other. Our relationships are what make our lives worth living. Please be sure to connect with the SEGO website and like us on our Area Agency on Aging's Facebook page to receive the most current and relevant COVID-19 information and upcoming webinars. And as always, I'm available by phone at 520-432-2528, extension 221, or by email at kenriquez@sego.org. Thank you very much.